And I rinse, holding my saliva ejector in there. Wait. All right, now I'm going to let her rinse. Have I given her the saliva ejector yet? All right, now if I needed to use the brush, so I'm going to get my brush out. But I'm not going to throw this one away. Why not? Because I might need it. Now the brush is kind of tricky. So you have to use good control because it'll bounce all over the place. Just kind of run your brush into the cup, and you just go straight into the occlusals. Like so. And have good control because see how it bounces. You can tear up some gingiva pretty good this way. So we use the brush generally when we're going to do sealants to clean the occlusals really well. Okay. All right, so that's the brush. Now I'm going to check again. Let me rinse her since I just did that. All right, I see a little bit right here. She's got some calculus. I'm thinking that's probably why. I'm going to clean her up when we get done. But I'm going to disclose her again. Why? Check myself before I have somebody come over here and check me. Alright, now sometimes, see how there's disclosing solution up on the lip? Sometimes it'll end up on the teeth, and we'll know that. Alright, but there's still a little bit. She had these grooves and things. Open up. I'm going to look and I'm going to get an idea. Everything looks pretty good. A little bit around there. Now she's got calculus here, so that's going to always stain up until it's gone. Alright. So I would go back, put my cut back on, and did I throw my prophy paste away? Nope. And I'm just going to go back to those spots. Her enamel's a little porous as well. So I just want to go back and hit those spots that I felt like I missed. Okay, so I'm going to rinse her again, and then I'm going to floss. Alright, and now the last thing you're going to do is floss, and you're going to take your floss and you're going to tear off a piece the length of your arm. Okay? I know how much it is, so I can just go and do it. So pay attention to how much, and you'll learn. This is great floss. It's a woven floss, okay, like yarn. And what you're going to do is wrap it around your middle fingers of each hand. And then you're going to fold them down. You're going to use your index fingers and your thumbs to guide the floss. And you're going to want your fingers to stay as close to the tooth that you're flossing as possible. All right? And so you're going to go in. So I have this hand on her cheek, this hand on her tongue. I'm going to seesaw it in. And then I'm going to push it in a C shape around the tooth behind, up and down, and then I'm going to pull it in a C shape and go up and down the tooth in front, and then I'm going to seesaw it out.
We're just going to remove some of the soft deposits in between the teeth that we missed. Absolutely.
And I kind of move the floss along in my fingers so I'm not twisting. You see what I just did? And she's got that lingual bar here. And I'm going to go back in just a minute with a floss threader. Turn this way. All right, now I just switched my hand. Did you see that? And I'm still at the same position, right? And I'm kind of fulcruming using my little finger of my dominant hand. Now I'm going to go upstairs. Notice how close my fingers are to the teeth. They're almost touching the teeth. And when I win the lottery, I'm going to have somebody floss my teeth and wash my hair every day. Because those are, now I'm switching again here, notice? Okay. Those are two things somebody else always does better. See how I'm in a C shape? You want to go behind the very last teeth, which most patients don't do. All right, so I'm not going to throw this away. And I'm going to get my bridge threader, and I'm going to open it up. And are my hands clean? They're contaminated, right? With her germs, right? So I'm going to get one out, and then I hand it to the patient. So they get the whole thing, right? I'm going to thread this through, just like a needle threader. Right? And I'm going to go underneath her lingual retainer. I'm going to push her lip down because it'll catch their lip. Pull it through, and I'm going to keep it doubled. It's easier to handle, and you're going to get more stuff. Pull it all the way through. So I'm going to do each tooth that way. So you find a little niche and you go to that niche.